Hey everyone, it's Silly Girl Blue back with another video. Today I want to talk about how Gypsy Roses microdeletion could potentially affect her pregnancy. Now, I want to start this off by saying that I am not at all trying to defend Gypsy Rose here. The fact that she is, in my opinion, a manipulative, dangerous murderer does not change the fact that her pregnancy may appear differently than the average woman because of her genetic deletion. So pregnant women who themselves have the microdeletion 1q21.1 are at risk of having a fetus with similar chromosomal abnormalities. While the phenotypic expression of this deletion can vary widely, a phenotype is how you appear to the outside world, while a genotype is your actual DNA. So the best way to describe it is kind of like a switchboard. The switchboard is your genotype, the genetics that your parents gave to you. However, both our genetics and environment influence the person that we become in our DNA. Your phenotype is which switches your environment allows to turn on your switchboard. That makes sense. That then builds the way that you look and your personality. And it's the same reason why identical twins don't have the exact same face or personality, because they experience the world differently and that affects their phenotypes, even though their genotype remains the exact same. So your genotype is like a switchboard. It could be a couple different things and your environment selects where it is on the board. So some of the more common phenotypic features associated with this condition when you're pregnant include variable ultrasonographic phenotypes, which says that in a retrospective study of 11 fetuses with this microdeletion, ultrasonographic, which just means inside their body, findings varied widely, including congenital heart disease, thickened neutral translucency, and normal ultrasound phenotypes. So, some people that have this microdeletion may pass it on to their kids in worse, and cause these things, exactly the congenital heart disease, everything I just said, or it might not. That's the thing with this, it might not. So there's cardiovascular abnormalities. In a study of 47 individuals with this microdeletion, cardiac defects were observed in approximately 23% of cases. There's genitourinary anomalies. Similarly, these are just abnormalities with your genetics or your urinary tract, and these were found in around 19% of the cases. There is some skeletal malformations, seizures in approximately 29% of individuals with it, developmental delay affecting around 74.5%, microcephaly, which is a small head size, was observed in 51% of the cases, and eye abnormalities were found in around 26% of them. And then, of course, the psychiatric and behavioral features that come with it, which is autism, anxiety and mood, schizophrenia. Those things could come about later in life, but could still be problems. But we're talking about a pregnancy here more so. So the fact that Gypsy's bump is small could be potentially because of this. Her baby might just be measuring small because she's having problems in her pregnancy due to her microdeletion. But it says here that an interesting note that I wanted to bring up doing this research so that you guys know I'm not defending her at all. But for pregnant women with a known microdeletion of 1q21.1, prenatal diagnosis and counseling are so crucial, it says. Chromosomal microarray analysis can detect the deletion in the fetus. You can only get this deletion if both parents have it, but allowing for early detection and informed decision making. When you can detect this early on in the fetus, it allows for early identification and informed decision making, which is the best chance at having a completely normal life. The variable expressivity of this deletion means that not all affected individuals will exhibit all the features. It's not a one-case model, it's pretty much. It doesn't really apply here, but I'm just saying that this could potentially be happening to Gypsy. It could not be. I don't know. I was wondering, has anybody actually seen Gypsy at a prenatal appointment or a doctor's appointment besides the ones that she's filmed? Because with her having this microdeletion that could potentially impact her pregnancy negatively, she most likely would have to have bi-weekly, if not weekly, checkups throughout her entire pregnancy because she would be considered high risk. I don't know if no one's seen it because they're private about that, but Gypsy Rose always seems like she's looking for attention. So that is really something interesting to me. I haven't seen any photos of her at a doctor's appointment besides the ultrasounds that she obviously grifted for. So that's an interesting take there. Let me know what you guys think about this, if you thought this was interesting, because to me it really was. I hear so many people talking about how her bump looks small, and I kind of believe she's pregnant. The reason that I think Gypsy is pregnant is because she has a pregnancy obsession, and she has since she was with Nick. It's honestly a problem. She was also trying to get pregnant with Ryan, which she probably would have done had her family not stepped in and like told her no. And I think the only reason she didn't is because she wanted to have the nose job. Like, that's honestly the person that she is. I do think she's pregnant because she's wanted to be pregnant her entire life, and she's wanted to have Ken's baby specifically because her psyche is obsessed with him, because she spent the last 5 years in jail just thinking about him with someone else. So yeah, that's why I honestly believe that she's pregnant, because she's that psycho. She sought Ken out just to get pregnant. Honestly, she might pull the rug from under my feet and I'm completely wrong, but I think that maybe she might be looking small, one, because she's trying to get skinny, so she's probably working out and like cutting calories, which when you're pregnant is so bad. Don't even get me started on that. Probably also has to do a little bit with her genetic disorder, because it will affect her pregnancy. It's not going to be a completely healthy, normal pregnancy. It was great talking to you guys. I'll see you in the next video. Bye.